Good afternoon. We are so glad to have our Facebook viewers on for this very important series. I am Dr. Sharon Allison Oddie. You can call me Dr. Sharon. And on behalf of Healthy Women, I am absolutely delighted to welcome you to this Facebook Live event, Bleeding Disorders in Women. Could you be at risk? In this second part, and please go check out the first part, in this second part of our two-part series, our focus is actually on living with the bleeding disorder. So the first part, we talked to experts. Now we're going to talk to the real experts, those that are living with the disorder and have intimate knowledge of what this really means, even as a caregiver. Menstruation, pregnancy, labor, and delivery all present challenges for women with bleeding disorders. Being an empowered patient is always important, but when you're a woman with a bleeding disorder, having the confidence that you can speak up and get the care you need is essential, and that you can be heard. Today, you will hear from real people, real women, and caregivers who are living with a bleeding disorder, and the two caregivers will share their perspectives. They will each share their journey from diagnosis to managing the day-to-day physical and emotional impact of living with the condition. And so we ask that you join us. We want you to tweet, tell somebody, pull somebody on and tell them to join us. And certainly you'll be able to see this later. I want to introduce our great panel. Jill McCary has presented with symptoms of bleeding disorder since childhood. Being adopted, she had no knowledge of her family history, and as a young girl, she was diagnosed with easy bruising syndrome. It wasn't until her daughter was 2 years old that she went to a hematologist, which is a specialist, that's a physician that specializes in blood disorders, and was diagnosed with something called von Willebrand's disease. Jill is now a wife of 36 years, yay Jill, a mom to an incredible daughter, and a grandmother of 4. She has spent most of her life working with those with special needs, and she enjoys helping those with bleeding disorders learn how to navigate and advocate for their own health. Thank you, Jill, for joining us. Next, we have Laura Ichanda, who dedicates her time volunteering with different blood disorder foundations due to her son's severe hemophilia B and her daughter's potential hemophilia. Laura works as an advocate for the National Hemophilia Foundation, who partnered with us today to bring you this webinar. The National Hemophilia Foundation's Better You Know program, and has a cultural guide to facilitating Spanish education workshops. She is also the volunteer director of the Female Factor and Women's Retreat with local bleeding disorders organizations in California. Hi, Laura.
Thank you so much for the invitation. It's a pleasure to be here. Thank you.
Also joining us is Laura's husband, Phil Ichanda, whose journey with blood disorders began when their 21-year-old son was diagnosed with hemophilia B. He is a volunteer with local chapters of the National Hemophilia Foundation, the Hemophilia Coalition B, and the NHF Good Cultural, where he created a local educational community group. Hi, Phil.
Hi, how are you, everyone? Nice to have been here, and we hope to educate everyone. Thank you so much for having me.
And then finally, rounding out this amazing panel is Penny Kampf, who is a von Willebrand outreach nurse at Hemophilia of Georgia, where she educates medical professionals, provides infusions and infusion training, and serves as outreach for undiagnosed women. Penny is a local, national, and world speaker regarding bleeding disorders and is currently chairman of the Nurses Working Group for the National Hemophilia Foundation. Hi. So, we have our group, and we are all just very pleased for them to be with us today. A little bit of housekeeping for our viewers. Please, please, please ask your questions. We're going to get to as many as we can. And we will do our best, again, to answer your questions, but also you can go back and view this at a later date. Before we get officially started, I do want to thank the National Hemophilia Foundation for their support in helping us bring this important series to life, and all that they do in the lives of persons living with, thriving with, and enduring bleeding disorders. And it's important for us to know, especially when we talk to caregivers, the fact that we can survive, we can thrive, and live our lives no matter what we face is important. And so thank you, National Hemophilia Foundation, for your support. Now, that's enough of me talking. Let's get things started. I want to talk about, how does a bleeding disorder diagnosis impact your day-to-day? And so, Jill, if you could start us off with that, how does it impact your day-to-day?
Well, I can say that now, being the wife of the 36 years and the grandma, my life is a little bit different than, say, when I was younger. I had a hysterectomy at 42 years young, not old, but 42 years young, due to basically a period that lasted for close to a year. So now I don't have to deal with that anymore. But I do have to deal with some little more aching joints, things that didn't get taken care of when I was younger, with bleeding issues that I deal with now. Something as simple as, going to the dentist, brushing your teeth, things like that. It impacts, all areas of my life. I have to think about, plan what I'm going to be doing. Most of us with a bleeding disorder have a little backpack that we have to take with us to take our medication, just to make sure that we're covered in case something pops up during your day.
Wow. And thank you for being very candid. Laura and Phil, how is it that these disorders have impacted your day-to-day, even as caregivers?
Yeah, for us, when my son was diagnosed since the beginning, it was really hard, dealing with the babysitter, because nobody wanted to take care of a child with the bleeding disorder. They're afraid, about the bleeding disorder. So finding a babysitter was tough. Also, as he was growing up, dealing with the teachers and at school, they wanted him to keep him kind of like in a foam, like in a little bubble, and and even that he has his prophylaxis and everything, we wanted to have him as a normal life, but the people that were, unknown to the diagnosis, we had to try to educate them, because that will help out my son have a normal life.
And Laura?
Yes, well, I learned the high bleeding to my son have. We needed have care about the bleeding, because sometimes it's danger. So when my son had like 2 years, he had a little ball here, like beans, the size to the beans. I talk to my doctor, I say, my son have one bumpy in the face and the forehead. He say me, okay, you need to come tomorrow because it's very small. So, and the next day I went up, I go to the hospital because my son have the head like double.
Oh,
size.
wow.
Yes, he have in the hospital for 5 days, and this helped me to understand. I need to know about what is the bleeding more danger for him. So we needed learn about who that care to my son.
Mm-hmm. And certainly, I'm so glad that we have caregivers on, because often we think of a disease or a disorder as only the patient, but you're all patients. I'm a geriatrician, and I always say mom is the patient, but the family is the patient. And I'm glad that Laura and Phil, you talk about the fact that you had to learn about the disorder. And then what does, and I'm going to go back to Jill, what does a bleeding episode look like for you? And you talked about a year-long period. Most women, we will pass out right now just from the headache of that. But what does it look like for you?
Like I said before, things have changed since I've had the hysterectomy, but a lot of the times it's a bleeding episode for me is a lot of bruising. I have a lot of bruises. I look sometimes like a Dalmatian, but I'm used to it. I'm used to the stares that you get from people when they look at you and you've got bruises everywhere. But the bleeding episode, like I said, could be bleeding from your gums when you brush your teeth. I had a lot of bloody noses. So those were very apparent when you're out in public, when you have a bloody nose that is hard to get it to stop. So, things like that. It can be embarrassing, but on the flip side, it can actually be a good conversation starter. So, to be able to use that as a conversation starter. To, I have a bleeding disorder, and it's actually very surprising. The more people that you talk to, especially women, the more you find out that they have a lot of the same issues. And there actually have been times where a woman that I've spoken to has gone in, gotten tested, and actually had a bleeding disorder.
Excellent.
So, yeah.
And that's so important for you to share your stories, because we need our viewers and everyone to know, and certainly the National Hemophilia Foundation, I'm sure, would agree that you are not alone in this. This is not, you are not having issues. You're not crazy. You're not seeing bruises just show up, that you could actually have a disorder. And you need to talk to your doc. And on a personal note, I forgot this with the first part. When I first finished college, I worked at the Environmental Protection Agency, and my boss, Dave, had hemophilia. And as his direct answer employee, he told me that confidentially, because there were times that he couldn't come in, that I would take over and all of that. And so we are important in the world is important in knowing more about hemophilia and bleeding disorders. I do want to go back to something, and Jill, you kind of hinted at this, but and Laura, I want you to chime in as well. How can a diagnosis impact your mental health? And that's for you, Jill, but Laura and Phil, what about that of your son and you as a caregiver?
So it can kind of play with your head a little bit. Like I said, when I was younger, the pediatrician actually called it, so I love it, easy bruising syndrome. I don't know if anybody's heard of that. I certainly hadn't heard of it. And I actually grew up with, my mom was a nurse, and I actually did not get diagnosed until after I'd had my daughter. And so I went through all of my adolescence, started on birth control at 15, which I'm sure some of the listeners probably can kind of agree with. Oh, hey, I did the same thing. So I started on birth control at 15 to control my periods.
Wow.
And so as a teenager, I actually got teased for having really long periods. I was in the era of where you had to take a shower during PE. So I had to have a doctor's note. And I actually had my PE teacher go, oh yeah, sure, again, for this long, you take a shower for for 28 days, and for 5 days magically you can take a shower. So that played a lot with kind of how I felt about myself. It really did kind of define a lot of my self-esteem. I was always worried about bleeding through pants, having an accident somewhere, having my nose start to bleed and not be able to get it to stop. So as I, and that's without knowing, because I did not know what I had.
Right.
Getting that diagnosis. So for anybody out there that even potentially thinks you have one, getting that diagnosis was the most empowering day of my life. I found that, one, I wasn't crazy.
Right.
I didn't have somebody pat me on the head and say, don't, well, although I did. The first doctor I went to told me I would outgrow it, but I finally had a diagnosis. I had a reason that I was bleeding. And so my journey through that and learning more, I have learned that it's just a part of who I am. It's not who I am. So I think as I've grown that mental strength, it's actually become something that I'm kind of proud of.
Excellent. I'm going to segue. I'm going to come back to Laura and Phil, but I want Penny, because Jill talked a lot about getting that diagnosis, and certainly has a nurse and a person that works in this area. I want to make sure, I want you to comment on the mental health part, but what are some of the gaps that you've seen? And I'm going to ask the other panelists this as well, but as a healthcare professional, and I heard that one of my colleagues said you'll grow out of it. Bless him. Anyway, one of my, again, what are some of the gaps, if any, that you've seen as it relates to bleeding disorders and the impact, as well as the impact both on getting a diagnosis, but the impact on mental health? Penny?
So I'm so happy to be here with y'all and join you this afternoon for this important thing. It's so near and dear to me. I have to say that I travel around Georgia trying to educate medical people, and they still don't get it. So we go to the OBGYN conference, we go to the pediatrician conference, we go to anywhere we can get our foot in the door to share what it looks like to have a bleeding disorder, and for them to know the right testing and the right diagnosis and how that works. So Jill said she was happy to get a diagnosis. Not everybody gets one as late as she did. Some pediatricians are good at screening and recognizing, but some are not. So it's all over the place. We still see newly diagnosed older hemophiliacs, which you would think that that would not happen. Your signs and symptoms of a bleeding disorder can be all over the place, and so it may take a bit of time to get that. The CDC reports it's an average of about 16 years for a young lady to get a diagnosis with a bleeding disorder. And that's because they may only show up having a heavy period. They may not have some of the other symptoms like the easy bruising or the dental problem or the nosebleeds, whereas a male may only just have mild nosebleeds and nothing else. So again, it's just hard to do that. And then in families, they think of it as being, it's just them. They don't think of it sometimes as we have a bleeding disorder. Mom, grandma, they all had heavy periods. So the little girl has a heavy period too. Or maybe the little boy has nosebleeds and he's going to outgrow it because he's got allergies, whereas a lot of times it's not allergies. There's a reason that you're having a nosebleed. So the right lab work, the right history taking from a healthcare provider has to happen. And sometimes when we go to the doctor, they're not pulling that history out of us. You know, they don't ask the right questions sometimes, or they're in a rush. I hate to say it. We're all so busy that we're seeing, 50 patients or something a day. So we don't have time to really dig deep into the history of your bleed. So it could go on for a bit until we get that. Now, the mental health is quite interesting. because we teach to your chapter can help with this. Your hemophilia treatment center can help with this. Having friends that have bleeding disorders can help with this. But we want you to have your best life and the most, I'm just going to say normal, whatever that is, that you will be as you age and grow up. We don't want to wrap you in a bubble and take you out of all the sports and you never do anything. You never ride a bicycle. You never get to go do things. We want you to have those experiences. So we try to work with families to let them do that. Now, sometimes the mother feels extremely guilty, or they feel like they caused this because of how it is passed down from generation to generation, or it's sex linked with hemophilia. I hear that in a lot of, especially the older ladies, that they were the ones that caused this bleeding disorder. Whereas we know it takes an X and a Y, it takes a mom and a dad to make you very unique who you are. So it's not just about that little X, it rides on this, it rides on that. It's, yes, we have a 50-50 shot at it. I'll share, my brother had hemophilia. My mother still to this day feels guilty that it's her, even though I share, it took both of you to create Tommy as a unique individual. She would say we look like a circus or a carnival when we go anywhere, because he's, back then had bad bleeding joints. We're in a wheelchair, we're in crutches. He's wrapped up with ACE wraps. We do this. And then I have parents, unfortunately, that show up in the ER and their baby looks like it's been beat up. And so they're going to remove the parents from the child to get a diagnosis. And we have to work that way. We have to be there for the children first, when a child comes into the ER. And then we go through the process, hopefully, of finding out why they have the bruising. It's not mom and dad smacked them around. But so much advancement has gone on in this area. And I hope we're living in a better world, as far as bleeding disorders, and we can get the education out there with what Laura and Phil are doing in their routines with California, and Jill as they're advocating for themselves and their families.
Penny brings up a great point, and I want to go back to Phil and Laura to just quickly hit we talk about the mental health impact on the patient. But certainly the mental health impact of your son having bruises. Did you give them to him? Or do you feel guilt and all of that? And just quickly, from a caregiver standpoint, and if there's something specific that you did to help your son and his mental health as he navigated through this, if you could quickly just share that with us.
Yeah, well, for us, the diagnosis was really strong, because we got diagnosed from a foreign doctor who was a Ukrainian doctor, and he didn't speak really good English, and we were Spanish, and our some of those terms in in English to Spanish are so different. So our doctor kind of told us, like, oh, if you have a son with hemophilia, if he runs, he dies. But if you have medicine, okay, no problem, he doesn't die. So when you hear die, and the doctor trying to explain our best, is for us, it's like, whoa, we got called into the cancer center, so we were like, wow, is he has cancer, or what is this? So it was really, really frustrating to us to know about hemophilia. And we had to remember when my son got diagnosed, it was 1999, that we didn't have internet. We had dial-up, so there's no access to the web or anything like that. So it was really frustrating for us, and took a mental toll on us. For my son, good thing, we changed doctors, obviously, for a reason. And when we find a new doctor, and he got implanted a port in his chest to get a better access and prophylaxis, then I think that kind of helped us out. And my wife found some book that a person called Laura Kelly sent her in Spanish, and she read that book in probably 2 hours, which is a big thick book. But we wanted to make sure to get that, and but ever since we got him in prophylaxis, and you know, we kind of like our mental state had gotten into a better state and understanding and learned about it.
Excellent. Excellent. Laura, did you have anything quickly to add?
Yes. So in many ways, I know that some people have gone to divorce. So you have feelings that gluten, anger, sadness, happiness, the happiness, the pair and fair. But this important thing in my case is that only say two options. So maybe sit to cry or face to fair, right?
Right.
Like this, I learned for zero. And I say to my son, this is no problem. You have only like storing the way. You can clean this or you can trip over it, right?
That's excellent. And that's excellent for any chronic disease and all of the things that all of us may or may not face. We have a question from the audience, and audience, please keep them coming. This is for Penny. And I would tell the audience, go back and look at the first part of the series where we had physicians and healthcare professionals on, and they talked about diagnoses, what tests, and all of that. But for Penny, what can you ask your provider if you're experiencing heavy bleeding and want to see if you have a bleeding disorder?
Well, when you show up to your doctor or provider, you do want to have an honest conversation with them about your signs and your symptoms, to maybe go with them written down and tell them exactly what you're showing with your body as far as your periods, if you're still having periods. Do you have bruising? Did anybody else in your family have the same things that you're showing? Because sometimes they're not going to ask you those things. The other thing you can ask for is the lab tests for a bleeding disorder. You can ask them to do basic blood counts to see if you're anemic, or your hemoglobin and hematocrit are working real well. But if you have tracked periods, you know, for the girls out there or the young ladies that haven't done menopause yet, go ahead and bring that information with you so you have documentation to really show them and to talk about that, because that's where it's going to show up a lot of times for you. If you had trouble when you were giving birth, if you had extra bleeding, if you have trouble when you have gone to the dentist, any of those things, you need to kind of write it all down and remember that. There are certain lab tests that are done. They can be quite expensive, if your insurance is not covering that. But you want to have that conversation with too, because the history and the blood work will key us into what exactly your diagnosis will be with a bleeding disorder. And then the family history. Now, some people don't have, again, as much bleeding as other people do with a bleeding disorder. But if you've had a hysterectomy and you're thinking, well, I don't have a bleeding disorder anymore, it does not take your bleeding disorder away. It just takes a symptom away. And people say that to me all the time. Well, I used to do this, but now I have had a hysterectomy. I don't do that anymore. Does not mean you still don't have a bleeding disorder. I'd like to put that out there too. I hope that answers that question.
Thank you. I want to jump in, and Jill mentioned having a hysterectomy and also being adopted. So for her, she didn't have the opportunity, I assume, Jill, to talk to your family or get medical records. But I think right around, and Thanksgiving is next week, and I said this in the other part of the series, when we sit around and gather, we must have open conversations with our families to say what runs in our family and what do you kind of deal with. It's not that you're being nosy, it's that you're getting information for generations to come. And then finally, and I'm going to ask this of Phil, particularly with your daughter, we focused on your son, but what was the impact or the conversation with your daughter regarding bleeding disorders?
I think that answer will be with my my wife, because that's my stepdaughter, so she has
Oh,
more
okay, excellent. Okay. So Laura,
Yes.
you're up.
So, I'm so sorry. Yes. Well, we have the problem with this because in California, the insurance not cover for the test. And I did have my only thing the doctor see for me is I have 14% the coagulation. And my daughter is living now in Mexico. She have some problem with the periodo, ya que es because he periodo is like when she come to United States to visit me, he have the periodo for 3 months. So in this time, she stopped like 4 or 5 days and come back again. So we know is the same periodo or the next periodo. So we need to go to the doctor, and the doctor sent medicine for her, and did stop. But he no have nothing, so she come back to Mexico and see the gynecologo, and gynecologo say, okay, you needed hormone therapy, and give it for 3 months, and say after 3 months you are okay. So she after the treatment for 3 months, she is okay, but only for 6 months more. But she come back again. She have anemia. We do the test for the CDC, and we have positive question for answer for the 7 to 8 question for the CDC
Oh,
test.
wow.
So we don't have diagnosis, but I know we have some problem.
Okay. Other questions, and certainly audience, you can chime in, but and this rather succinctly as we're starting to run down, what kinds of conversations are patients having with healthcare providers about rare bleeding disorders? Jill, what now has a woman that's past your period and all that and your grandmommy, but what conversations are you having at your annual physical exam or your general conversations that you're having?
The conversations now kind of center around keeping my joints healthy. Really, dental care is very important as well. It's really nice that I've got a really good rapport with my primary care provider, which isn't always the case. I know when I was younger, I never felt like I was heard. So it's really important for women, especially, to make sure that they feel like they can have an open conversation and communication with their provider, and to be able to bring in, as Penny said, bring in the history of the periods, the history of nosebleeds or bruising is so important. While I don't have periods anymore, I still have bleeds that I bring up with my physician, and we discuss how that is, how that looks, and then make a plan for that next year.
I will say this as a physician with thousands and thousands of friends that are and colleagues that are physicians. I will say this, and as a patient advocate, if you can't talk to your physician or healthcare provider, you need to talk to your good girlfriend or somebody else and seek a physician or healthcare provider that you can talk to. This is partnership. It's your health. I used to say and still say all the time, if something happens to you, we'll pat you on the back, we'll hug you, we'll love you, but you and your family have to live with whatever disorder it is. And so with every medical condition, be in partnership. And I love what you said, Jill, and even Penny talking about bringing the information and asking, requesting, requiring that you both speak and be heard. And then Laura and Phil, anything that you want to add about, again, how do you engage? And Laura, I love that you talked about the problems actually in some healthcare, in that you couldn't get the testing you needed. How do you engage and navigate for persons as a caregiver?
Well, it's complicated, I say, because the insurance is not cover so much things. But I try find information in the internet, and I know we have good tools like CDC tests, like programs
Mhm.
like you, and like um, in another program also. And this moment I not remember, but it's complicated. When sometimes the doctor knocking out, the primary doctor knocking out what test you needed.
Right.
I say also in hemophilia, because my son, when I go to the doctor, say I don't know what he needed, so he needed send me for the specialist
That's
because
right.
no knocking out what test you needed.
Excellent. Phil, any insight into this?
Yeah, the main thing is, and something we have learned, especially with different doctors, is that we have to educate ourselves,
Yes.
and that's the most important, because the doctor might suggest something that maybe, yes, is their duty as a doctor to offer this solution, but maybe it's not the right solution for your son.
Right.
And the primary goal as a caregiver is we have to look what is the best for our son.
Mhm.
And 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 then also, as he grows up, and now he's 22, and he start taking his own decisions. Okay, we're still involved in his life, and and part of it is when he turns over 18, the doctors don't want to talk to the caregivers.
Mhm.
You're
Mhm.
on your own. And that my son was like throwing off to the walls, kind of
Mhm.
like what do I answer, what do I do, they want me
Mhm.
to do,
Mhm.
they want me to sign for gene therapy sessions,
Mhm.
and is it
Mhm.
right for me or not,
Mhm.
so we have
Mhm.
to coach him in a way that where he goes onto the adulthood, that he
Mhm.
can make his right choices and know what his normal life can be.
Excellent. This is a great segue, and great minds think alike. I was coming over to Penny because there's a question from the audience. What are some tools and methods that can be used to find the right hematologist? And as a reminder, the hematologist is the bleeding disorder specialist. And Laura certainly talked about the need for specialists. What tips can we provide as far as some of the tools and methods to find the right, also primary care doc, but let's focus here on hematologists or specialists.
So, yep, great questions. So, you can actually look online and find out where the federally funded hemophilia treatment centers are across our country. And that is really the gold standard of care for anybody with a bleeding disorder, is to go to a federally funded hemophilia treatment center. I have to say, all of the studies do indicate and show that if you receive care with a bleeding disorder at one of those centers, your outcomes are much better for yourself as somebody with a bleeding disorder than if you go to a primary standalone hematologist doctor. So most hematologist doctors that I have seen across Georgia, and I would guess there to venture to guess across the United States, actually deal more with oncology and other blood disorders than bleeding disorders. So their first train of thought is more towards that side than it is to somebody with a bleeding disorder. So if your primary care person is good enough to do lab work that indicates that you might be one with a bleeding disorder, then you should end up at a hemophilia treatment center for your best care, I would say.
Excellent. And I just want to make sure that we are all clear. One is find a doctor. You can go online, look for bleeding disorders, whether it's von Willebrand's or it's hemophilia, or just put in bleeding disorders in your zip code and do that. I do love going to the centers, but if you're in a part of I come from North Carolina, I'm in Maryland now. Also look at universities that have a medical school attached or a teaching center. You may particularly be able to find a specialist there. And then as we close out this part, one comment from the audience says that we need to focus on educating OBGYNs to look for signs and symptoms when women come in with heavy periods. And that's not only our colleagues that are OBGYN, it's not only physicians, because we said a lot about doctors, but remember, healthcare is a team approach. So you have nurse practitioners, physician's assistants. The nurse is absolutely vital. Whoever you can talk to, and I hope our panelists agree, you should be able to talk to and share and know that you're part of a team, but you as the patient are the coach. And I think that's important as we kind of round out, how do you find someone? And I do believe in all of the research online, but I have to also say, when you find a specialist, let the specialist be the specialist, have dialogue, and ask your questions and write them down. There's a question for Laura and Phil. How did your child cope with being in school dealing with hemophilia? And what kind of conversations did you have with teachers? And either of you can answer this.
Yeah, one of the problems, it was at school. We had a lot of problems at school. One time, the teacher called us, and said, "Oh, your son just being hit with the bat," and we were like, "What?" Is like, really? And how is it? No, he's okay. But just wanted to make sure you know that we already took care of the other kid, and he's been, and said, "But is he hurt or something?" No, it was a foam bat. I'm like, okay. So we kind of like, it's okay, it's a foam bat, and so we had to educate the teachers, and also like the PE, especially in PE, they didn't want him to go like everyone's doing running laps on the track, and they had my son running on the grass area, and my son was complaining. I was like, "Dad, I really want to do the track, but they put me on the grass and there's potholes everywhere, so I could get actually more in danger, or having one of my ankles in one of those potholes and get a bleed or something." So I had to really went into the school and educate them, about it and how was the normal things. And also, as he going into high school, they have a health class, and we when we had the health class, there's a chapter actually about hemophilia, and my son was the one who gave the chat for that particular time, and kind of show up all the students what was dealing with hemophilia, and that kind of embrace all the students, to actually see him as a normal thing, and I think my son has never been shy about it, his hemophilia, with his friends in school or anything. He had a poor cat thing in here, like a little, when they took it out, they had like a little scar, and he always joke about it. It's like, "Oh, it's because I always wrestle with sharks," and that, and they were like, kids are like, "Really?" And like, no, I have hemophilia, so and his friends actually embrace it, so actually his friends will protect him and make sure that he was, make him more as a normal life in school, and prepare the teachers is one of the things, and that's a problem, because sometimes most of the bleeding disorder organizations, they have seminars and everything for the immediate family, but they forget that the people that are outsiders, they need that information, and sometimes they haven't provided that information. That they should have some seminars for those outsiders, so they can come in, and learn about the hemophilia, and that's one of the things that we're trying to do as a parents with education.
Excellent. Now I'm going to change a little bit, Laura, because I want to segue into something that you is near and dear to you. And I'm going to ask all of the panelists to answer this, but I'm going to have Laura start it. What are organizations for people that are watching us, that are watch us on the record? What are organizations or groups or websites that are have been instrumental in your journey with bleeding disorders that you would recommend? And Laura, I know you do a lot of advocacy work.
Yes. Well, one program is really good. The better you know, you have the test in Spanish and in English,
Okay,
and have
excellent.
some questions you can answer, and then they say you if you have probability to have someone bleeding disorder or something like this, and they refer what you can do. So it's
Okay.
a really good program.
Okay. And other organizations like National Hemophilia Foundation, they have resources?
Yes, the National Hemophilia Foundation have so much resources you can find on the website to the NHF. And for now, I am so happy because it's more open. So some years ago, and the doctors no recognize it like the hemophilia, the woman have hemophilia. So now it's more open to the doctor can listen you what you needed and what you can have.
Others on the panel want to share any information as it relates to organizations, support groups, or where you can get help?
Yes, I think your local chapter is the beginning of the of the journey. When we first got our son, and when they told us, oh, there's other people that have hemophilia, and there's a chapter, and they have events where you meet these people, and so always look for your local chapter at the beginning. And then from there, you have the National Hemophilia Foundation, and there's other organizations like Hemophilia for Coalition B, which is dealing with patients with hemophilia B only, but also, and there's the War Hemophilia Foundation. So it has been open more, especially as the internet has grown up, and there's more sources on the net, always. But I say start local, because I have seen people that didn't know that they have a neighbor that they were the same, they live in the same city, everything, and they had hemophilia, and they thought they were alone, in their area or everything like that. So there's a lot of organizations, but start on your local chapter.
Jill, do you have any other organization to add or support groups?
I was going to say that if you go to the National Hemophilia Foundation's website, you can find your local chapters, as both Belle and Laura said. In through those local chapters, you'll find that certain events will be taking place locally. So that helps a lot. So that builds your little tribe locally. And then you have people that and can count on at any time. There are blood sisterhood and blood brotherhood. So those are national groups that get together, and they'll have events that you can attend online. This is the good thing about COVID is it really brought things that happen at a national level a lot more local. So for those of us that found it hard to attend annual meetings for the National Hemophilia Foundation or the Hemophilia Foundation of America, now can go. So where it was cost prohibitive or too far to travel, now you've made a lot of connections within those groups. And as Laura said, there's the Better You Know. You can go to betteryouKnow.org and take the test, take the little quiz there, and look to see if there's a potential that you could have for a bleeding disorder. And then through there's people that are out there that you can connect with. And so to give yourself your tribe, that's the best thing. That
it does take a village.
It does. It
Yes,
does.
we all have our tribes. And so Penny, one of the things that you have a different perspective, has both a caregiver and a sister, but also has a health professional. So what would you like to add as it relates to support groups? We know that statistically finding a support group with any condition helps.
So yeah, so it's the good news is back just a few generations ago or a few decades ago, we didn't have all this support structure.
Mm-hmm.
So now there are camps for kids. There are
Mm-hmm.
many things going on that will help support the family. And there is somewhat, I know we spoke a little bit about some families fall apart, get divorced. You know, it is a big stress to have a child that has a chronic
Mm-hmm.
condition, but our medicines are getting better. Our support groups are getting better. There's more education out there, and we talk more openly about it. You know, used to, you didn't share if you had anything wrong in your family. It was kind of hush-hush a lot of times. So those are all big helps. I do want to point out there is a foundation for women and girls with bleeding disorders as well. And they have a wealth of information about, you know, women and girls with bleeding disorders. There's also the World Hemophilia Foundation too. That's great. NHF. I'm hoping we have a few healthcare nursing people on our program today. We have nurses guidelines at NHF, and we're going over them with a fine-tooth comb and updating as we go. So there's many helps out there for folks, and I would think some of the chapters probably have events or processes to hook you up if you're a new person or a new family with a bleeding disorder that you've never had before, never in your family history, that maybe you can find a mentor or a peer support kind of family to help you too. And I think those are great avenues.
You know, Penny said if you're new to a diagnosis, and this questions, I'm going to start with Jill, and then I'm going to move down to Laura and Phil. What did you wish you knew when you started this process and first found out about your diagnosis? Very succinctly, what do you wish you knew, Jill?
That I wasn't alone.
Excellent.
That's what you have a tendency, even though I was very excited to finally have a diagnosis, it made me feel alone. I'm adopted, so I didn't have anybody else in my family that had the same issues that I did. And I went to a women's expo, and I turned around and there was a big sign that said, "Do you have heavy periods? Do you bruise easily? Do you have nosebleeds? You might have von Willebrand disease." And I walked up to her and I said, "I have that." And the first thing she did was gave me a hug. And she became my first peer advocate that showed me what to do. But I spent the first little bit feeling alone. And so I wish I would have understood that I wasn't alone.
Excellent. Laura and Phil, from a caregiver standpoint, I'm sure you would echo that isolation, but is there anything you want to add of what you wish you had known at the beginning of diagnoses?
Yes. So for me, I recommend that you find out the symptom. For you have to know if you have blood disorder, or you can know about conditions like carrier, that you can talk with the doctor, and you can test the offering for the CDC or for the better you know. And the parent of children and daughter with bleeding disorder approach to the foundation for they close to there in every state. So it's available in NHF. They need you can visit the website. I could like to know they are alone. O sea, you need to know you're not alone. Okay, you have so much resources. This is really really important.
You're not alone. And then Phil, succinctly, anything to add? What you would have wanted to know at the beginning of the process?
I think that the most important thing that I really was looking for answers was when I saw other families and I
Mhm.
saw their kids, they were growing up. So because the hemophilia used to be you didn't live more than 13 years old,
Right.
and when you read on the old, hemophilia. So when I saw the new parents that have a 15-year-old, okay, I say, well, my kid is gonna be okay when he's 15. When I saw a kid that was like 21, I'm like, well, my kid is gonna be okay when he's 21 because there's another kid is, like that.
Mhm.
So I think that from the back diagnosis, if I had some other family know, from the beginning, or the chapter, or the HTC, says, hey, we have a family with the same disorder, kind of connect you with them so you can have some
Mhm.
answers.
Mhm.
That will
Mhm.
be the great helpful for me from that.
And certainly one of the greatest things that you all should know that are in the audience and will watch this on replay is this is a great series, sponsored in part with the National Hemophilia Foundation, that we're talking real talk about how you live with this disorder. How do you navigate? And then watch part one. We've kind of taken it full circle today, from how do you get diagnosed? What do you think about? What do you take to the doctor? And had doctors and nurses and nurse practitioners talk. But now we're talking to the people that are in the trenches. And we only have like a minute and a half left. And I'm going to start with Penny. I want you each to just tell me in a sentence or two, if you had someone sitting in front of you right now that was questioning a diagnosis or had been diagnosed, and we know that they know they're not alone. But now, what else would you tell them from your perspective? Has a person touched by bleeding disorders? Penny, can you start us off?
Sure. It's been a pleasure to be here with you all. And I would say we are here for you as a nurse and part of the clinical team at an HTC. And I'll give you my phone number, and we're here to help you. And you are not alone. And we will give you all the education you need at the time that you need it.
Excellent. Phil?
Yeah, I think the best. Thank you for having me here. But the thing is, for every parent, educate yourself. Learn the most you can about hemophilia. Talk to those that are surrounded, that have an impact connection with your kid. The teachers, people that are outside. Teach them about hemophilia, and also know your rights as a patient.
Excellent.
Yes, and so you can advocate and know your rights as a patient, and decide what is the best treatment for your kid, and have a normal life.
Laura, very succinctly, what would you want our listeners or viewers to
Thank
know?
you so much. I only say to the people, remember, you're not alone. You are around, have around so much resources: social worker, doctor, foundation, camping group for the kids, for they can learn to injection. So you're not alone. You need a resources, and I wish everything is fine for everyone. Thank you.
Excellent. And Jill, the topic is women with bleeding disorders. So as a woman with the bleeding disorder, I want you to round us off and tell us, what would you want our viewers to know?
Okay. Just like everybody else, thank you so much for highlighting this important topic. I think the biggest thing is educate, advocate, and share. So educate yourself, and then you can educate your doctors, you can educate your family and your friends. Advocate, learn how to advocate for yourself. It's the most empowering thing, whether it's advocating for your healthcare, advocating for a friend, and then share your story, share the love. The bleeding disorders community is an amazing community.
Excellent. And now I wouldn't be Dr. Sharon if I didn't end it with, I'm going to say what I think. One is, thank you all for having me. Thank you all of the panelists. I've learned a lot. Phil got me in the first minute when he talked about finding a babysitter. Who knew? I never thought about that. So it's so important for us to learn from people in the trenches. And then I always talk about Ask Me 3. I'm not going to stop now. You need to be part of your own healthcare advocacy. And remember, you're the coach, right? It's your health. So never go to a doctor, a specialist, a dentist, a podiatrist, anybody, and not come away with these 3 questions answered. 1, doc, what is my main problem? 2, why is it important? And 3, what the heck are we going to do about it? If you have those answered, whether it's bleeding disorders or any other aspect of health and wellness, you will be further along in being and living your best life. And I think all of the panelists say, for even the listeners and the viewers here, this is not a death sentence. I love that Phil gave the comparison that his son is now 22, did y'all say? 22, living, doing well. Jill is a living example, and our targeted audience of women living with bleeding disorders. Thank you all. And on behalf of Healthy Women, I again thank our panelists for being so open and doing what Jill said, which was to share for your participation today. And once again, thank you to the National Hemophilia Foundation for their support and what you do every day in this area. For more information, we ask you to visit hemophilia.org, betteryouKnow.org, and that's KNOW, and healthywomen.org, which is the resource for women's health on a variety of topics. And you can view both this recording, part 2 and part 1 of Women and Bleeding Disorder. This series has been phenomenal. I learned a lot. And I want to thank you all for joining us. Share this on your Facebook page, share it on your YouTube page, share the information. Someone you know is probably impacted by a bleeding disorder. Thank you all, and you have a wonderful, healthy day.